Hey everyone, welcome back. I'm Dr. Shayna Keller, a naturopathic doctor, and today I have a guest, Dr. Daisey, who is also a naturopathic doctor, and I'll let her introduce herself.
Hi everyone, I'm Dr. Daisy. I am a naturopathic physician as well, and I am super pumped to be here today.
Yay, excellent. We're going to talk about thyroid and gut health and how those two go together. Something I've seen clinically is when we work on the gut, it actually makes it easier for the thyroid to kind of relax. I think about the thyroid more as a warning sign, kind of a signaling that, hey, something is going on someplace else in the body and it's trying to compensate. Is that something you kind of see in your practice too, Dr. Daisy?
Oh yeah, 100%. Especially like when we talk about the gut microbiome, we talk
Mm-hmm.
about absorption of nutrients. Your thyroid needs so many nutrients to feel
Mm-hmm.
good. Where are these going to be absorbed? That's going to be in your small intestine. So we've got to make sure the gut is in tip-top shape to help any thyroid patient.
Definitely. I agree with that. Yeah, I was reviewing before our podcast some basic physiology, which I often will do. Go back to the basics, I like to say. 20% of thyroid hormone, T4, is converted to T3 in the gut from our microbiome. All the bugs that live in our gut help us with 20% of that. It's pretty crazy.
hmm And if we look at our like Western diet, we look at what we're eating and how that's impacting that whole leaky gut picture.
Mm-hmm.
If you don't have a gut that's in tip-top shape, your thyroid will suffer. And these are like really simple nutrients, but that again, that's coming from food sources that are not going to be the processed foods. Are we paying attention to healthy amount of fibers and berries and citrus, that kind of thing, versus the packaged good?
Definitely. And I mean, making sure you're getting an appropriate amount of iron. The Western diet is pretty devoid of seafood. I personally don't love seafood. I live landlocked. There's not a coast, and I know you can get it flown in, but it's not the same as when I was living on the coast and like you can go get fresh fish that they caught this morning, right?
Mhm.
One of the things I will often recommend to my patients is maybe we just need to supplement with iodine. I'm personally not a big fan of iodized salt because it's so high in
Mhm.
sodium compared to like mineral rich salts like Redmond's Real or Celtic Sea Salt. There's a few other brands that people are pretty big fans of. What's your take on iodine?
I'm very cautious with iodine, especially when we look at thyroid conditions. So there are two
Mm-hmm.
different types. You have the hypothyroid patient, then you have the Hashimoto patient. That's more of the autoimmune form
Mm-hmm.
of a thyroid condition. These patients' labs and their well-being tend to like vary so much. You've got to be really cautious about how much iodine you're giving them. I have some patients who do really well with a little bit of it, and then I have others where a little bit just sends them just through the roof. They're not
Mm-hmm.
doing really well. So we've got to pay attention to who we are talking to versus all not what the literature says all the time.
Yeah. So basically, you're saying it's individual and it depends. That was the most common answer I heard in medical school, and I was like, it's so frustrating, but it's so true.
True.
Yeah.
Yes. And I think something we need to think about is who is the thyroid patient, right? We haven't talked about that, but thyroid conditions are affecting so many women
Mm-hmm.
specifically, and they come to us with fatigue, weight issues, gut problems, because if your thyroid function doesn't work well, your gut motility will not work well.
Yeah.
So that's something to really pay attention to. It's women. Men also do have thyroid condition, but almost always women will suffer from it.
I agree. I haven't seen. Actually, I take that back. I've got one male patient that's got hypothyroidism, Hashimoto's, but all the rest of my thyroid patients are female. And what's really interesting, and I remember learning this in school, that hypo and hyperthyroid can present with the same set of symptoms. We
Yes.
traditionally think about hypothyroid with constipation, skin dryness, hair falling out, weight gain, but I've actually seen people with hypothyroid that have lost quite a bit of weight and their hair is falling out and they're constipated. It's really fascinating. So I test their labs, which is why it's so important to test and not
Mhm.
guess and see where the patient is actually sitting at from a laboratory value standpoint. And you've already alluded to this. It's important to think about the human in front of us and not just the person with labs, because if they, we got to think about the biopsychosocial model too, and really tailor our approach that fits best in their lifestyle, but also making sure that they're getting the care that they need to move forward, right?
Exactly. And often when they come to see us, they don't really know where they're at. It could be thyroid, it could be lifestyle related. We don't really
Mm-hmm.
know. you and we get labs. And especially in the beginning stages of a thyroid condition, you may have a shift. You may start as hyper, then
Mm-hmm.
go hypo, or start as hypo and then go hyper, or then an autoimmune condition comes into the picture. So we have to be really cautious of retesting labs, checking in again until we find what's truly going on with you.
Absolutely. Something that's interesting is a lot of endocrinologists won't run antibodies. I mean, you're lucky if you can get them to run T4
Yeah.
without a TSA or just T4 and TSH. And very rarely do I see a patient come in with T3 ran, and pretty much never do they have antibodies run. Like it's like pulling teeth to get them to run. And
Yeah.
TSH can be normal, and you could have antibodies that are off the charts. There are 3 antibodies that I have run for patients, especially if I suspect hyperthyroid. I will run anti-TSA, TSI, and anti-TPO and anti-TG are the 2 that are most commonly associated with Hashimoto's or hypothyroidism, low thyroid function.
Exactly.
Mm-hmm.
Exactly. I think what I've noticed is unless a patient has had part of their thyroid removed or they're like postpartum or something, they
Mm-hmm.
almost never will run the T3. But as we know, I'm going to explain that right now. Your thyroid actually is in your neck. So there's a little signal that goes from your brain to your neck to say, hey, make some T4 and make a little T3. But
Mm-hmm.
most of the active form of the hormone is T3. And that conversion from T4 to T3 may happen in some people or may not. So you have the patient who has decent level of TSH, adequate T4, and yet they're still tired.
Mm-hmm.
We've got to look further. That's the conversion. So to make thyroid hormone, you need protein. You're going to need copper. And you're going to need also iron and iodine. But that conversion of T4 to T3, which happens in the liver, is going to require selenium and zinc. And that's
Mm-hmm.
sometimes not needed. And that's when we go to work as
Yeah.
naturopaths.
Yep, and most of the conversion happens in the liver. And when I like had that moment of clicking in my mind of like, oh, they're poorly converting, likely a sluggish liver, which I feel like I'm on repeat when I see patients. It's like, oh, liver, 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 liver and microbiome. Those are the 2 like we've got to make
Yeah.
sure we're taking care of. Just doing something as simple as castor oil packs I've seen make a huge impact for patients, shifting their conversion rate that's a little bit sluggish and slow. But you're totally spot on, making sure that they have proper mineral content to be able to do the jobs that we're asking the body to do.
And even with the mineral content, you are the expert about the heartburn. We
Mm-hmm.
see so many patients who have a compromised gut microbiome, or they have
Mm-hmm.
that whole leaky gut picture, the increased intestinal permeability. So now they're taking all these nutrients, but it's poorly absorbed. So
Yeah.
you're doing all the right things, but you're not focusing back to the root cause of your gut
Mm-hmm.
issues, which is that increased intestinal barrier. So we've got to make sure we focus on that first before even worrying about your hormones.
100%. And I mean, before I even do supplementation, we start working on the gut with some simple things, making sure the person is eating enough protein, that they're able to digest the protein, because that's one of the questions I will often ask a patient. Are you eating enough protein? Most women are not, in my experience.
Mhm.
And the second is, okay, sure, you're eating enough protein. You say you're eating protein with every meal, but you're not digesting it. So we have to make sure that the digestive system, and you alluded to heartburn, which is a common thing we see when digestion is not happening properly, malabsorption basically. And I love that you bring up leaky gut, aka intestinal permeability, which is what it's called when you actually look into the literature itself. And it shows up. And there was actually a study I was reminding myself about. I'm not one of those docs that says everybody needs to be dairy free, everybody needs to be gluten free,
Oh,
but there is a lot of data on being gluten free, at least temporarily, to allow the immune system to calm down, which is what happens with autoimmune conditions. You kind of get a little bit like revved up, freaked out immune system, and we can start reacting to things that the body normally can tolerate, like gluten or wheat products, right?
exactly. Especially when that whole autoimmune picture comes into play. That is the only time I'll tell a patient, you've got to be fully gluten free. Otherwise, I'm just like you. I'm not a big fan of labels for like, you
Mm-mm.
have to be gluten free or dairy free. But if I'm suggesting a diet for you, it's because I'm expecting a change in your well being. So gluten
Mm-hmm.
is going to be one. That is number one. And then, of course, dairy. But we know our environment is so polluted. So if you're going to go to Europe and have their croissant, you might feel okay. Yet when we come to the US, then it's sprayed with so many things. So we have to be mindful of who we're
Yeah.
talking to. What's their lifestyle? Are they mostly organic eaters versus non-organic eaters? It's going to be a big thing.
Yeah. And I was just having this conversation with my husband too. It's like for me, oats and wheat products are non-negotiable, need to be organic because of the pesticide, the herbicide that gets sprayed on them, glyphosate, aka Roundup. It's not even used to kill other plants. It's used as
Nope.
a desiccant. So it's sprayed in high quantities. And there was a comparative study that looked at the use of glyphosate and the incidence of celiac and how like those numbers go up. And I'll make sure to link that study in the show notes so you guys can take a look at it. And I know correlation doesn't mean causation, but I mean, it's really hard to argue with the lines. They are literally on par with each other. And celiac wheat intolerance was not a thing when I was a kid. That was not a problem. And we also didn't have kids that had severe peanut allergies either. Like there's definitely some things in our environment that are somewhat out of our control and do have some cost prohibitive components to them. But to the best of our ability, there are certain aspects that if we can be non-negotiable, it's definitely better to do that.
Yeah, especially when you look at thyroid function in the liver. The liver does so much for you. Yes, number one is with classification of the foods, but everything we're putting on our skin, we're drinking, also happens to go through our liver.
Yeah.
Medication overuse also is a
Oh
thing.
my gosh.
So many people are over medicated. That's also going to be a burden on your liver. Alcohol. So everything we do, it's going to go through your liver, and there's a detox process that needs to happen. And some people, it is slower. So now it's going to show up as estrogen dominance or acne, or again, poor thyroid function.
Right, exactly. I often will talk about supporting the liver. I don't know about you, but I'm not really a huge fan of doing these like 30-day liver detoxes. I do think that they have their place, but I'm more of a fan of like making sure the liver has proper nutrition, B vitamins, minerals like magnesium, to be able to go through those phase 1 and phase 2 detoxes so that the liver is doing its job properly. I will often make this analogy. In today's world, our food, our water, our air, is polluted. Not to mention the fact that most Americans are on at least 2 medications. I had quite a few patients recently on like 9 and 12 medications, which is a lot of medications. Not saying they don't need to be on them, but that puts an extra burden on the body. We're asking the liver to do 12 liver jobs. I'm being dramatic, but it gets the point across. We have one liver and it does over 300 processes. And then you add in all these other interesting lifestyle components that we humans like to have, especially here in the United States, where we're heavily medicated.
Yeah, it's a tough go
It
because
is.
I'm a big fan of supporting the liver with herbs because I find a relationship with almost every thyroid patient also has higher cholesterol and
Mm-hmm.
higher liver enzymes. And
Mm.
often it's still their diet, but it could be just the toxins from the environment. So the water they're drinking, is that from a glass bottle or a plastic bottle? The lotions they're using. I went through my like personal detox over the years of being in school, but
Mm-hmm.
I find that if you're using something pretty consistently, let's make sure it's as clean as it possibly can be for your body. You love nail polish, great. Find the cleanest source of nail polish possible. So
Mm-hmm.
it's about transitioning our lifestyle slowly. It's not so much dump everything in the trash. That's not realistic for most people.
No.
But what can we do to slowly lessen the burden on our liver, lessen the inflammation reaction in our body? And that's again, it's that microbiome. I was reading earlier about like dysbiosis, the imbalance of good and bad bacteria in your gut. Also pathogens. So bacteria is like H. pylori,
Mm-hmm.
SIBO infections, all these little things are attacks to our immune system, which most of it is in our gut. And if your immune system's not happy here, none of us are going to be happy.
Mm-mm. Yeah, SIBO is small intestinal bacterial overgrowth, and the way I describe that is the gut bugs that live in our colon, which are used to being able to, the colon is made to be able to have fermentation processes, moves into the small intestine, where you're not usually supposed to have fermentation happening. And that's where you can get the really nasty gas and bloating pain that moves around in your gut. Most of our mineral and vitamin absorption happens in our small intestines. We have these cute little like brush borders is what we call them. They kind of look like little toothbrush pieces, and they're little microvilli, and they absorb our nutrients. But what happens when we're having leaky gut or other dysbiotic issues, we have less of those little fingers. I kind of think about them like they get mowed down, and we have less surface area to absorb our nutrients, which is why it's so important that we work on the gut. Some of the main things I will often use, aloe. There's actually really good data on aloe, and I know you just posted a Instagram about it as well, and I've posted about it previously. It's like doing 2 ounces of aloe juice twice a day reduces thyroid antibody levels by 40%, which is pretty crazy. I can't remember, was it over 3 months? Like, that's pretty impressive.
Yep.
And
it's impressive, and it's also inexpensive too.
It is. Yep, relatively speaking, I agree with you. I'm a little bit particular about the brand of aloe because there's a lot of brands out there, in my experience, that are not telling you which part of the plant that they are using. So it is very important that you are not getting whole leaf aloe unless you want to have poopy pants.
That's really important. You got to make sure it's the gel part. So that's good.
Mm-hmm.
But yeah, so supporting the gut microbiome is something we need to talk about. And again, that comes in the diet, right? So having appropriate protein intake is good for making thyroid hormone, but you have to support the microbiome. That's fibers. I don't know that we actually eat enough fiber in our diet. Most of us don't. So for most men, it's going to be about 35 grams a day. For most women, it's 25 grams a day. That's just numbers, right? Just look at your plate. How much of your plate looks nice and green and colorful versus not, versus like more beigey food, I will say. Even though potatoes are really good for you to have resistant starches in there. But looking at fiber in our diet means supplementing with a little spinach for breakfast with your eggs, adding a little salad again for lunch, and then for dinner. And all of that fiber is going to ferment where it's supposed to be, fermenting in the colon, and it's going to be energy for your cells, which means your cells now can relax and slowly migrate back to being closed again versus being open.
Exactly. You guys are getting a sense that the way that we think about this isn't just like, oh, thyroid. We're only going to target the thyroid. We're kind of thinking about it from a full body approach, because that's how we actually reverse chronic illness. Now, I always tell my patients this is an area of weakness for you. So you've got to be mindful that, like, hey, you start getting run down, you start staying up too late, drinking too much, not taking good care to eat a mindful diet that's nutrient dense. We might end up with some more thyroid symptoms again later down the road. Fiber is so critically important. The two things, protein and fiber, along with liver and microbiome. I feel like a broken record all the time talking about this. And I would say the average, what was the stat from the USDA? I think the average American is getting about 10 to 11 grams of fiber, which is just terribly inadequate. 25 and 30 grams or 25 and 35 grams. Like, I know those are numbers. What I usually have my patients do is get out like Chronometer or FitBuddy or whatever one of those apps are, and kind of track for a few days to kind of get an idea. Like, okay, a tablespoon of nuts and seeds gives me about 4 grams. And adding vegetables with every single meal. Oh, but I have my yogurt, I have my oatmeal in the morning. Okay, great. Also, make some celery sticks or some carrot sticks with you. And if you have a salad, a lot of Americans prefer ranch. Ranch is not helping you digest your salad at all. And most of us have a really difficult time digesting raw veggies. So I often will encourage people, especially dealing with some gut stuff, to make sure to have them warmed up. Or if you want a salad, that you are doing some kind of vinegar or lemon juice or some kind of acidic dressing that actually is helping to break down things before they go into your mouth. One last piece about digestion, you've got to chew your food. I had a patient who's been seeing NDs for quite a while, and he was like, oh, no one's ever told me that I need to be chewing my food. I thought we just don't digest corn. If you are seeing corn in your poop, it's because you are not chewing your food. It's not because we don't digest it. It's because digestion of carbohydrates starts in the mouth with our teeth. We do not have teeth in our stomach or any place else. So if we are mindlessly just shoveling food in, and I've been there, I'm guilty too. Like, sometimes I'm eating on the way to work. Like, that's yes, and take that pause, chew your food thoroughly, especially if you are dealing with chronic gut issues right now related with thyroid stuff going on too.
Yeah, that's really important. Digestion is important because,
Mm-hmm.
again, we're moving to absorption and elimination. And you mentioned something really important, which is the acidic nature of our foods and the acidic nature of our stomach to also break things down to eventually be absorbed.
Mm-hmm.
Heartburn doctor, Dr. Keller, definitely paying attention to the medication we're using and how it's preventing us to absorb certain nutrients. So,
Mm-hmm.
our stomach supposed to be very acidic. We like it that way. If you're going to constantly be using medication, sometimes it's warranted to pump that stomach out of you. You're also going to pump out all the nutrients that you could potentially be absorbing. And we mentioned
Mm-hmm.
this before. Iron, number one. You got to have iron. Iodine, copper, zinc, selenium, all these nutrients are going to need a more acidic environment to be absorbed. So the food first, and then we work on the stress factors and everything else that impacts our gut microbiome. Because again,
Mm-hmm.
in our environment, we can only control so much, right? But
Mm-hmm.
can we control what we put in our mouth? Most definitely. Can we be more educated? Can we be more curious about what we actually are eating? Natural curiosity will make you a lot healthier in this country.
Definitely. I love that, being a little more curious. And the way I explain things is like, now you get to explore other things instead of just thinking about having bread with every meal. Now you get to find maybe a new favorite food you never realized that was out there, just waiting for you to find. You mentioned something that was really important: stress. I
Mhm.
definitely see an adrenal component, and the adrenal glands live on top of our kidneys. We have two of them. I call them the party hats. They produce a lot of different hormones for us: sex hormones, sugar hormones, stress hormones, and salt hormones. And there is certainly a correlation with people that get run down emotionally, physically, stress wise. And then that puts a little bit of extra stress on our gut and our thyroid, and kind of an upstream effect. Is this something you see too?
Oh, 100%. So it's interesting. I have patients who come to me fatigued. We're
Mm-hmm.
all tired, sure.
Oh
But
my
could it,
gosh.
I know, could it be your thyroid condition? Could it be an adrenal condition? It could be a sex hormone versus like an ovarian condition. So
Mm-hmm.
looking at hormone, even though the term hormonal imbalance is a terrible term, that's not really a true medical thing because our hormones are naturally shifting throughout the day, throughout the
Mm-hmm.
weeks, even in the healthiest person on the planet. However, I can think of hormonal imbalances when it comes to which organ is supporting the other two that are like just not functioning
Mm-hmm.
as well. So that's when the adrenal piece comes in, the ovarian piece comes in, and again, it comes back to the liver. So
Mm-hmm.
our liver is going to make certain proteins to bind our hormones. Even the healthiest liver will make some proteins to bind our hormones. But is it making too much of a certain protein to bind our hormones because something is in balance, like estrogen? So when estrogen goes high, almost always thyroid function will start to slowly decline because there's something called thyroid binding globulin. It's a protein that we all make. It happens to be a little bit higher in those who have estrogen dominance. And the easiest way to work on it, besides working on estrogen clearance through the liver, is also supporting healthy progesterone, which is another hormone that
Mm-hmm.
all of us women make. So, yes,
Mm-hmm.
I do see sometimes the thyroid is not really the problem. Sometimes it's the gut, sometimes it's the adrenal function from all our stressors. And again, stress is a big word, but stress can be a work environment. Stress can be an injury or after surgery. Stress can be mental, emotional, or physical. So I think when people think of stress, it's always my work is stressful, my relationships are stressful. But no, stress can be really internal. Trauma is a stressor to our body. So there are a lot of ways to talk about stress.
So many ways, and that's a really important thing that we parse it out. Is not all stress is bad stress, and there is definitely a little bit of interpretation, but sometimes people's plates get a little bit full, and we all just went through the COVID thing. That's pretty dang stressful, like a lot of uncertainty, what's going to happen here. And I've seen a couple of my patients that take really, really good care of themselves end up with some thyroid dysfunction because we just went through this thing
Mm-hmm.
together as a country, as a world, sort of. And come out the other end and say, well, you know what, I eat a good diet, I prioritize sleep, I make sure to get good protein, and then there can just still be these like extra pieces that are somewhat out of our control. And it's really a good idea to make sure you have someone on your team. I want to pivot because I'm thinking about someone. Are you familiar with Dr. Brownstein's work?
No, actually, I'm not.
Okay, so he's a medical doctor who's a big, big fan of high dose iodine. And I'm talking milligrams, and we're we usually think about iodine, or at least I do, in micrograms. And that's how much our body needs, is about 150 micrograms for a non-pregnant
Yep.
individual. He talks about 150 milligrams per day, which is a lot. That's what is the, that's a whole, God,
Conversion, like, yeah.
that's a whole 1,000 points higher. That can throw you, and you alluded to this in the very beginning of our chat, that can throw people into a hypothyroid state. Iodine has this weird back and forth where you can put yourself into a hypo state with not enough and a hyper state with too much. It's one of those minerals, like iron, like zinc, like copper. We need the appropriate amount for our body to function, not too little, not too much, Goldilocks. And every person gets to be biochemically a snowflake, so we have to make sure to find the appropriate amount for the individual sitting in front of us. And that's where the "it depends" comes in. And it's really hard to find a supplement or create a protocol for all of our Hashimoto patients or all of our hypothyroid patients, right?
Oh yeah, I think I sometimes have to apologize in the beginning. It's going to be a lot of different things. I'm so sorry, but my goal is to always reduce the list as we progress in your healing. Because sometimes when people come to naturopaths, we're like their last hope. They've been on so many things. They've had so many testing done. Sometimes they're even skeptical of us being able to help them, you know? And when you suggest like a bunch of different things, you're like, well, more supplements to take, right? But it's truly because your care is so individualized. We have to really tune in on how much nutrients we're doing to support you. Where are you at right now? Where are you going to be in 2 months? Or, you know, a few weeks from now, and how we can change levels with being so specific. So yeah, I'm like, I'm sorry, you have 5 things right now. Let's go down to 2 next time by doing all these other good things. So I used to be someone that did not really believe in supplements until I really started to understand how much our food is depleted of nutrients, how much we're struggling to get the right foods into our diet. And often when we're meeting someone at their lowest, we've got to give them everything so they can just get up in the morning and just go about their day and just do again. And then once they're able to find their lifestyle changes, the balance in their life again, we can slowly now back off of all that we've given them. It's just we got to meet them where they're at.
Yeah, I call that renutriation. I know that's not the proper word, but I kind of like making up words as I go because it's a little more fun.
Yes.
And that fatigue that you're talking about is so profound for some people. And we're talking moms, people that have full-time jobs, people that are doing a lot of different things, and they don't have an option but to be able to get up in the morning. And I was like you. I did not love doing a bunch of supplements in the beginning, but I have found, and I've spent quite a bit of time with farmers, and especially regenerative ag and biodynamic farmers. I will hopefully have a farmer on the podcast at another time to talk about this. But if the soil does not have the nutrients, the plants will not have the nutrients. So we say you got to eat a good diet and you never need to supplement. I actually don't think that's true anymore. Unless you are eating 100% of the time from a regenerative agriculture producer that's super mindful of the cycles of nature and making sure to put things back into the soil. And there is, a trend that people are catching on to this, but it's happening a little bit slower than I would like it to. I really think this is how we shift climate change and the loss of our topsoil. But also minerals don't exist in the Earth's crust in an equally distributed portion throughout the Earth. And I don't know about the soil where you're at in Arizona, but where I am, it's super alkaline. Some of the farmers will actually put sulfuric acid into the water to break up the calcium and the salt that's in the soil. So it's actually bioavailable. Ton of calcium here. Colorado's notorious for hard water. Can't absorb it. It just makes your hair crispy and like really dry.
Oh no. Yeah, that's why it's so important to really supplement. Even selenium. Everyone say just eat 2, Brazil nut today. You'll have your selenium. Maybe it's 3, maybe it's 4. Again, that all depends from the soil content. I was reading a study about Japan where the seafood there, the water there is so much higher in nutrients and iodine that they have less incidence of being hypothyroid from low iodine versus us Americans, where, well, our salt is from whatever at the grocery store, right? So it comes down to what are you taking in? Is it bioavailable? You've mentioned that again multiple times
Yeah.
because when you're looking at nutrients, there's zinc. There's like 5 or 10 different types of zincs. So
Yeah.
is magnesium. So are all the other supplements. So B vitamins, B12, methylated B12, cobalamin B12. So we've got to find the right form for you for your needs. Zinc, for instance, is a big one where we look at that leaky gut, that again, that increased intestinal permeability, where zinc carnosine is the
Mm-hmm.
one we're going to be using. The basic zinc glycinate is not going to really do much for you. So again, working with someone that knows their stuff, like a naturopath. I'm sorry, I know people love the functional MDs out there, but I'm a big ND fan because that's our job. We've studied this for hours in and out. So please find a naturopathic doctor to work
Mm-hmm.
with you when you're looking at getting your nutrient back on track, getting your life back on track.
Yeah, absolutely. So, to summarize, it's very individual, our approach that we're going to take to someone with a thyroid condition, and really focusing on the gut, making sure you're absorbing, you have proper digestive juices at the appropriate pHs, kind of thinking about digestion from north to south. We've talked about making sure you have a good diet. Sometimes being gluten free can be necessary, especially if there's an autoimmune picture going on. We talked about addressing leaky gut, aka intestinal permeability. We talked about the importance of several minerals and nutrients, but we've got to address healing the gut before we add in all those nutrients. We also talked about some other dysbiosis that can play a role, like SIBO or H. pylori infections. And really, there is a difference between functional medicine practitioners, and I've seen PAs, NPs, MDs, DOs, chiropractors. Naturopathic doctors are the OG functional medicine. The guy that created functional medicine, Dr. Jeffrey Bland, the Institute of Functional Medicine, was actually teaching at my alma mater, Bastyr University in Seattle, when he opened that clinic up and started teaching other professionals. I am okay with it, but I very much agree with Dr. Daisey that naturopathic doctors are far superior in this arena, and it's worth your while to do a search. One of the ways that I will send people that hit me up on Instagram is look at the American Association of Naturopathic Physicians website and do a quick search. Also look in and see if there's a state organization. What is there, like 27 states that are licensed right now or
About that.
regulated for naturopathic medicine? So you can look at state organizations and see if there's an ND near you, or you're always welcome to send me a message and say, hey, I live in Houston. I don't know how to find an ND. I don't know. Google's like the way that I function in life. I don't know about you.
Me too. I mean, Google. I feel like I've since I've been out of school, I've been able to like network through social media too a little bit. Like I know people that like you in Colorado, for
Mm-hmm.
instance. So I'll send because I do a lot of virtual health. I know you do as well.
Mm-hmm.
But some you really just need someone in your town. So I'm
Yeah.
gonna make an effort to find someone right next to you so you can at least get the care you need.
Yeah, good physical exam. There is no replacement for a good physical exam. And you're right, I will accept virtual patients, but I definitely encourage people to find someone local. I want to support other NDs and make sure that they are getting into their community. Anything else you would like to add?
I don't think so. I think we've kind of talked about like a lot of good stuff today. Yeah, I'm
Yeah.
pumped.
Yeah, this has been really good. So, I'm Dr. Shayna Keller. If you found this video super helpful and was informative, like and subscribe. We'll be doing more of these interviews and kind of understanding how the body works as a system. Dr. Daisey, how do people find you?
Through social media most of the time. Instagram is definitely the place for me
Mm-hmm.
at Dr. Daisy. Well, that's it.
Yep. I will make sure to link her Instagram page below in the show notes. And thank you guys so much for listening in. Have a great rest of your day.
Bye bye.